Thank you, Mr. Chair. Thank you to Dr. Yiu and Mr. Sussman and all of you for being here. I'd like to start with the responses you gave to questions earlier and in your earlier statements about performance measures. And you've talked fairly extensively about that. But when I look at the Ministry Business Plan from Budget 2018, there's one, perhaps if we're stretching it, two performance measures related to mental health of all performance measures in the extensive Ministry of Health. So I'd just like to ask you if the two measures that we see in the business plan, one being the percentage of mental health patients with unplanned readmissions within 30 days of leaving hospital, and the other being emergency visits due to substance use, are those the only two performance measures that you track as it relates to mental health?
We track other performance measures that aren't published within the business plan and the annual report. We can provide information on some of those at a later date. As you can imagine, there's all kinds of different ways that you can assess population health outcomes from a mental health perspective, but we are very selective in terms of what we put in our business plan.
I see that. Are these the two most important performance measures?
I think all performance measures have a level of importance within healthcare.
So why are these in the business plan and others not?
As Milton Sussman, as we've been working through the Valuing Mental Health Next Steps, we have been engaging with all of the partner organizations with Alberta Health Services to develop other reporting mechanisms, which we are working with them. We're compiling the information. I think those will inform future business plans on what different measures we start to indicate that we start to track.
So am I to take that as a commitment then in future Ministry of Health business plans that are published for all Albertans to see, that we can expect to see both an increased number as well as a more targeted set of performance indicators in future business plans?
We'll have to work through in what we can put in the business plan, but certainly we will have a more robust reporting requirements that we will be making public that will related to addictions and mental health.
So, Mr. Tremblay, in response to my earlier question, you said you track a number of performance indicators that are not public. Can you give us some examples of what those are? Sure,
and this is just a sampling of some of the performance measures that we do track. So, dispensation rate of antidepressant and anti-anxiety medications, emergency department data, hospital separation, mortality by cause of death, self-perceived mental health indications as well, presentation to ED for first identification of a mental health issue, primary care physicians. Can I ask you to
please table a full list of those performance measures?
I've already offered to do that, but certainly can.
As well as results over time against those performance measures, not just the measures themselves, but also results, please. Thank you. And so when I look at the structure, I've got some questions about who's actually in charge. On page 8 of Valuing Mental Health, you've got a nice table here that says the Executive Steering Committee reports through an advisory committee and a number of secretariats. But the annual report on page 19 says that Alberta Health, not the Executive Steering Committee reporting to the Minister of Health, leads, but you've also got this advisory committee. Can you tell me who ultimately is accountable for implementing the Valuing Mental Health Next Steps?
Ultimately, the Department of Health is accountable for implementing the Valuing Mental Health Next Steps report. I chair an executive steering committee with the deputies of other departments, and we have a large advisory committee of stakeholders that also gives us advice.
Would you like that responded to in writing?
I think that's.
You've got your
sure.
answer.
If there's a possibility to respond in writing, thank you.
Okay, Mr. Hunter.
Thank you,
Chair. I'd like to focus my questions on child mental health. So in Value in Mental Health, recommendation number 6 is improve mental health and education outcomes for children and youth by enhancing school-based addiction and mental health programs. And number 17 is about increasing awareness for teachers, administrators, students in school and post-secondary. So my questions for you are, what specific actions have been taken? I know you've mentioned this DMs panel, and that's important. What I'm really interested in is, what does that look like on the ground? What specific actions and what outcomes are we seeing specifically within the education system?
Well, Albert,
Do you want me? Well, maybe I'll start. So, as we said, we can't keep doing the same old when it comes to trying to work with children on addictions, mental health issues. And we know that 70% of addiction mental health issues actually start during childhood. And so it's very, very important to actually work upstream. And so we've been working on something called the Mental Health Capacity Building Program. We're really, really proud of this program. This is a program that we've now expanded, I think, to over 97 communities, over 100,000 children, and about 350 schools, I think, and expanding it as we go along. And essentially what it is about building resiliency in children. It's providing tools and supports to actually help children deal with some of the stressors that they undergo, but it's also about providing tools and support for the families. So this is another issue around the previous question that was on caregivers. This is a program we know works because this is based on best practices, and there have been many other jurisdictions that have built these types of resiliency programs for school-age children. And what we do know is that it does impact how they deal with their own struggles as they become adults. And we think this is ultimately, I would say, the long-term goal that will have an impact on outcomes for adults who have addiction mental health.
Yeah. Can I just ask, how widely deployed is that program currently?
Yeah, so it's about 350 schools so far, but there's many educational sessions beyond that, and 97 communities. We recently received another grant from Alberta Health to expand that to another 15 sites, and we're actually going to be targeting the additional schools actually on some of the Indigenous communities and the vulnerable population. So we're actually quite excited about that work.
Are there particular challenges? I mean, health is the largest ministry, education is the second largest ministry. Are there specific challenges in working within and between ministries in terms of accountabilities, funding? I imagine community and social services may play a role there, perhaps justice. I mean, so we're kind of talking about like 80% of government here. Is that I mean, are there specific challenges there? Are there barriers that need to be broken down that are constraining this work?
the executive steering committee that I mentioned earlier is really structured to address some of the barriers. I think there has been a propensity to fund different initiatives in different ministries, and we were finding that there was some duplication there, and there was a lack of coordination in the valuing mental health in the creation of the next steps and that steering committee. One of the steps that the steering committee initiated was developing an inventory of all of the funding that has been provided to different organizations by different departments, and so that we've just completed that inventory. Now the departments are working together to develop a plan to really coordinate funding between ministries and to coordinate direction between ministries.
So can I ask here, just in my last few seconds here, how you measure that progress? I know you've said you've created this inventory. If you can table the measures that you use, the outcomes, and specifically if you can table that inventory of funding that you've created, I'd be very, very interested in seeing what that is, and also what changes have been made as a result.
So the inventory has just been completed. But we can provide you information on that.
Thank you. Member Lowe?
Any information or an inventory related to the inventory of funding for education mental health related to valuing mental health recommendations number 6 and number 17? Any action plans and measures of progress relating to those same recommendations, please?
Okay.